Hi, I'm Dr. Julie Marmon, and I thought we could talk a little bit today about the new blood pressure guidelines that came out. The ACC and the American Heart Association got together with a bunch of really smart people, and they sat around and they looked at our recommendations for treating blood pressure. This is the first time this has been done since 2003, so there was a lot to review, but it turns out we're doing a lot right. The biggest change is that they've now dropped the limit at which you are considered having high blood pressure. So in the past, 140 over 90, that top number is 140, that bottom number is 90. At that point, when your numbers hit there, we said, oh, you have high blood pressure, you need treatment. What they've decided now is that 130 over, I'm gonna make sure I have this right, 130 over 80 is now considered high blood pressure. There's a couple reasons they did that, and it is not a conspiracy for everybody in the country to be put on blood pressure medications, because what this does do is about triples the number of men, especially those in their 40s who have high blood pressure, and doubles the number of women, especially, again, those women in their 40s that have high blood pressure. So why do we care? Why did they do it? What's really the big deal about high blood pressure? Most people don't even know if they have high blood pressure. But here's the problem. High blood pressure over decades will lead to problems. And when we talk about problems, these are problems it's a list as long as my arm, and these are big, bad problems. And we see them every day. Everybody knows somebody with one of these problems. Strokes, TIAs, dementia, coronary artery disease, congestive heart failure. We get problems with our arteries. So you can get aneurysms in your arteries, meaning these little balloons. So if you have this nice vessel, all of a sudden you get a balloon and it's a weak wall, and that can actually rupture and cause massive bleeding and death. So huge problems, kidney failure leading to dialysis, vision problems, erectile dysfunction. The problems are myriad. And if we recognize high blood pressure earlier, we can probably help decrease the rate of some of these problems. So what does this lowering of the term high blood pressure, that lowering that number, what does it mean? Well, it means that we're recognizing it sooner. And we're saying to patients, hey, look, your blood pressure is 130 over 80. It's not normal, which is 120 over 80. That means we need to talk about what to do. Now, the guidelines are great because they don't suggest that when you hit 130 over 80, that you have to go on medication immediately. In fact, just the opposite. The recommendation from this panel is that you actually start with behavior modification. And there are a ton of things you can do for behavior modification to lower your blood pressure, which is perfect. Unfortunately, it's not easy. If you've ever been my patient, you've heard me say, staying healthy is hard work. Getting healthy is even harder work. And that's no different here. So what do we do when you have high blood pressure greater than 130 over 80? And I know there's somebody out there who's saying, well, what if only one of those numbers is high? If only one of those numbers is high, then, so you fall between and again, I'm going to look at my notes a little bit, 120 to 129 over less than 80, you're in elevated blood pressure. So if you're getting into those numbers, you need to start thinking about some of these behavior modifications to avoid those catastrophic events that can occur later in life. So number one, every time, lose weight. 10 to 15 pounds. If you can lose that, you will make a difference in your blood pressure. That's number one every time. Now, what weight matters? If you've heard about metabolic syndrome, that's the weight that we carry sort of around our waistline. That tends to be the bad weight. If you're carrying your weight there, it's time to start thinking about losing it, especially if your blood pressure is high. There are other implications with that waistline weight to think about, but that's a whole different topic. That'll take way too long to discuss today. Exercise regularly. The American Heart Association has been talking about this for years. Regular exercise does help keep you healthy, and it will help keep your blood pressure lower. Eat a healthy diet, high in vegetables, high in fruits, lean meats, low-fat dairy, low in cholesterol, low in saturated fats. Look up the DASH diet, D-A-S-H. That's what the American Heart Association still recommends. Also, lower that sodium. That's been a big controversy lately. I would say everything in moderation. Some people will say, oh, it doesn't matter. It probably does, and you should look at the norms that the American Heart Association recommends for your sex and age. Also, lowering your intake of alcohol. I'll let you look up online what's safe for men and women. probably about a drink a day max, but it will affect your blood pressure over the long term. Smoking. I don't think there's any question that smoking is bad for us. It's bad for your lungs. It's bad for your blood vessels. It's bad for your heart. It's bad for everything. Don't smoke. If you have high blood pressure, this might be the hardest behavioral modification to make, but it's one you should definitely make as soon as possible. Caffeine. So this is a little bit controversial for me as a physician. I make my way through almost every day, especially as a physician mom with a cup of coffee in hand. So I actually spent some time reviewing this a little bit more. You might get a transient bump after drinking a cup of coffee. If you do and your blood pressure goes back down, or it's not a big bump, no big deal. Caffeine probably in the long term will not bear out to be a big problem. So don't panic. Don't panic. But if you do check your blood pressure after about 20 to 30 minutes after drinking a cup of coffee and your blood pressure raises significantly, you might be one of those folks who needs to cut back just a little bit. The last item that to consider is decreasing your stress. Stress will affect your blood pressure, and there are a myriad ways of doing it. Managing expectations, time management, getting enough sleep, expressing gratitude is the latest thing I've read that will help manage your stress. But all of these things in combination, used in moderation, will probably decrease your risk of high blood pressure. Now, some people just have bad genetics, and that's just the way it's going to be. If you do need medication, you're probably going to need 2 to 3 medications as you progress in age to control your blood pressure. It's something you should definitely be seeing your primary care physician for. They are so good at this. This is what they do, and they are ready to help make a difference and coach you through this. Please check the AHA, American Heart Association website, the American College of Cardiology. They all have great information. And good luck. Stay healthy. I know with a little bit of behavioral modification, if you do have high blood pressure, you're going to make a big difference in your life, not only now, but in the years to come. So stay healthy.